Welcome everyone to today's webinar, How Hospitals Can Get an Upper Hand on Contract Staffing. On behalf of Becker's Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to welcome our presenters. Jeff Niles, Executive VP of HWL, Tommy Binner, Vice President of HWL, Megan Faye McCaffrey, Network Director, Physician Services of University of Vermont Health Network Medical Group, and Maxine Briggs, CFO of Samaritan Health. Thank you all for being here today. I will now turn over the floor to you.
Hey, thanks so much, Tammy. We really appreciate it. And thanks for everybody for jumping on and taking the time to talk about what we think is a very important issue as we continue to evolve as a healthcare enterprise. So today, what we're going to cover in the learning objectives, as you can see here, is we're going to learn the distinctions between a vendor-neutral MSP and an agency-run MSP and the advantages of a non-agency staffing partner. So when we're talking through this in the future, that vendor-neutral MSP is one thing. The agency run, we're going to be discussing that as really that master agency MSP. So if you see that in the future, that's really what we're talking about. Secondly, we're going to discover how an open and transparent marketplace reduces costs and enhances quality. And lastly, understand how a vendor-neutral program leverages an agency-funded model, allowing systems to implement at no cost. Those are our learning objectives for today, and we're really looking forward to this conversation and looking forward to your questions at the end of this session. We're going to go ahead and do another introduction today, just so everybody gets a chance to know who's talking on the screen today. I'm Tommy Binner, and Maxine, I'm going to kick it over to you and let you introduce yourself.
Well, thank you, Tommy. I'm Maxine Briggs. I'm the Chief Financial Officer for Samaritan Medical Center in Watertown, New York. I've been with Samaritan about 5 years now. And prior to coming here, I was the system controller for the St. Lawrence Health System in Potsdam, New York, and I was there for 12 years. I think it's also important just to share quickly that during this time frame that we're talking about, in 2020, I did take on an interim Vice President of HR role, Human Resources role, that has spanned the COVID pandemic. So some of my insights today are because of that dual role, and I think it allowed me to have a little bit more insight as a CFO that maybe I wouldn't have had before.
Thanks so much, Maxine. Megan, you mind introducing yourself?
Absolutely, thank you. My name is Megan Faye McCaffrey, and I'm the Network Director of Physician Services at the University of Vermont Health Network. I work for the medical group, so I focus on servicing the physicians and the APP population. I have been working at the health network for, believe it or not, 18 years. And I remember that very clearly because I actually came to work at the UVM Health Network back when I was on maternity leave. So my daughter, aging myself, is 18 years old now, and I was so impressed with the way I was taken care of as a patient at the health network that I just couldn't get enough, and I had to find a way to be part of it. So I've really dedicated my career to taking care of physicians and executives alike with all their different HR needs. So special place for me. It's wonderful, and I'm allowed to do what I love doing every single day. So I'm glad I get the opportunity to share some tips and tricks that I've learned along the way with all of you today.
Excellent. Thanks so much. Jeff?
Good afternoon. My name is Jeff Niles. I'm Executive Vice President here at HWL. I've been with HWL since 2018. Proud to say I was employee number 4, so got in pretty early and have enjoyed the opportunity to watch the organization grow. Prior to HWL, I spent 11 years with a company called ShiftWise, which was one of the first vendor-neutral VMS platforms in the healthcare industry. I was fortunate enough to be early on in that organization as well. So all combined, I've been in the contingent workforce management industry for over 20 years and have worked with hundreds of hospital systems across the country in a variety of capacities. So thank you for your time today.
Excellent. And I'm Tommy Benner, Vice President at HWL. I've spent the last 16 to 17 years in workforce, whether with locumtenants.com in a staffing role, in a telemedicine startup company, and with a scheduling software company over the last 17 years. So I've been firmly entrenched in healthcare staffing, healthcare workforce, and technology. So really excited to be here talking to you all today. With that, we're going to move on and let Maxine and Megan introduce their organizations and let you get a better sense of kind of what they are. Maxine?
Yes, thank you. You have on your screen some information about Samaritan Health, but I'll give you a little bit more information that might provide some insights into our operations and provide some backdrop to some of the things we'll talk about today. We are a 290-bed sole community hospital. We're about 70 miles north of Syracuse and about 30 miles south of the Canadian border or east of the Canadian border. We have an inpatient acute rehab. We have a mental health unit. We have a level 2 neonatal ICU. We have a large cancer center that we have a clinical affiliation in with Roswell Park that we're very proud of, and we have multiple physician specialties. We do have 2 nursing homes, about 440 beds. We do have a 120-bed assisted living facility and a home health agency. I share all of that with you because we believe that we really have a full spectrum of care in the community, whether it's your acute care and then transition into long-term care, your post-acute care, and our home health agency as well. We do have about 2,400 employees, so we have a very significant population of employees. We are the second largest employer in the county, only second to our Army base, which is about 10 miles north of Watertown. We are the main, the other thing that's unique about us is that we are the main medical provider of health services to the U.S. Army base at Fort Drum. They have about 1,500 soldiers and then their families, so upwards of 30,000 lives on the Fort Drum area. They do not have, which is very unique for us, is they do not have a hospital on site, on base, or the schools. So the schools, our community is providing the schools, education, and the hospital, which leads us, that's a very different model than most Army bases. That's about us, and I'll pass it over to the next one.
Yeah, so I will pick right up here. So the University of Vermont Health Network Medical Group. So we are an academic health system. We straddle both New York and Vermont state, which is cool. So we've got both the Green Mountains and the Adirondacks all around us. I always describe us as a bit of a trifecta, if you will, because we've got the mountains, a beautiful lake between us, and we've got our friends in Canada right up north of us. So pretty glorious place to be and work. I'm located actually out of our Burlington, Vermont office. So I feel very fortunate for that. We have 6 hospitals in our system, and we also have home health and hospice as well, which is an extension of us as well. And we have multiple residency programs going on at all times. We're spreading that through our network now, which is new to some of our community hospitals, and super excited to watch it get some traction and move. We are somewhat of a new network, if you will. I'm going to say the medical group is somewhat new. We came together, we merged from Fletcher Allen Healthcare, which sounds like a very long time ago because it feels like a long time ago, into the UVM Medical Center. That was in 2011. Fast forward, we stood up a physician organization, then cleverly retitled it the UVM Health Network Medical Group back in 2018. And that was bringing all of our smaller hospitals in partnership and in cohesion with our large academic medical center. I was privileged enough to be the project manager who was assigned to standing up the physician organization. and later naming it the medical group. So I've seen a lot of the evolution over the years, and I think that that'll come true to my story as we start digging into a little bit of where we were in the locum space some time ago. So look forward to chatting more about it.
Thank you both so much. What a diverse background you both have, and we're really excited to have you guys here to be able to talk to the backgrounds you've had and the work you've done with the workforce management. Just a little bit about HWL. We're founded in 2016 when Jeff was in his early 20s, obviously, because he was number 4. And we're located here in Alpharetta, Georgia. So really, HWL is a technology and process optimization company that's concentrated solely on healthcare workforce. And we want to make sure that our customers are really getting that competitive advantage in a dynamic workforce marketplace. We are focused intently on our outcomes, like lowering costs, creating higher quality, and really just that overall greater transparency. And so while we're all doing that, are really wanting to make sure that we're concentrating on patient care and striving to make sure that our clients, our partners, are getting the very best healthcare providers they can with as least stress and as minimal cost as possible. So without any further ado, we'll get into the meat of the presentation. This first slide here, I know that since it's a Becker's webinar is hosting, that I thought it'd be great to start with this article, which is really timely this year already, this article, and I've seen more just like it come out. This one titled, "The Number One Problem Still Keeping Hospital CEOs Up at Night." And if you look down here, the number one thing that's keeping CEOs up at night is workforce challenges. I don't think to anybody on here that should be a surprise, but by evidence by this Becker's article and many others around this topic, workforce challenges continue to be the most pressing topic in healthcare and for those healthcare executives. As there are many workforce challenges that today's healthcare executive is working through, the use of a staffing agency or multiple staffing agencies is playing a big part in the solution, but it's also part of the challenge as well. So as the rates for many of these specialties and provider types are falling back down to orbit, there's been a heightened level of scrutiny placed on the use of contingent labor and the agencies that represent them, and which we feel like is a very valid in this market. The use of staffing agencies has always been an important piece of healthcare delivery, emphasized even greater during the pandemic and now beyond that time frame. But because agencies have grown in number and in size to meet that demand, it's important to be able to understand how staffing agencies operate and are motivated. And so over the last decade, probably decade plus, much more over the last few years, healthcare organizations have been seeing a lot more work and attention be paid to properly run a contingent workforce plan. They've turned that over to many VMS and MSP partnerships to manage these contingent workforce. And so whether we're talking locums, nurse, allied, non-clinical, and that really can range the gamut, we're talking about using a VMS, and these healthcare can bring some transparency and also clarity to what is often considered a disjointed plan by using staffing agencies and using a lot of them, while also really relieving that stress from the recruiters and executives that are working with this large amount of agencies and the large amount of providers that are coming through those agencies. So in the remainder of this webinar, we're going to discuss 2 different models of MSP, master agency owned MSP and the vendor neutral MSP. With the help of Megan and Maxine, we'll learn more about why vendor neutral MSP that's knowledgeable about, is a knowledgeable partner, advocating on behalf of the healthcare organization, provides the best opportunity to fill contingent workforce needs at the best rates, under the best terms, and with as little stress as possible. So as we talk through this today, I want to ask a couple questions just to get us started. Maxine, first question for you. Would you and the other executives at Samaritan agree that this is the number one challenge that you're facing today?
Thank you, Tommy. Yes, I would absolutely agree that this is the number one challenge that we face. It truly is the things that keep us up at night. And some of the things we did when we started seeing this, I think we all saw in 2021, really seeing that impact on the workforce challenges. And I remember mid-year, the amount of positions in over a 4-month period were attention getting, how many open positions and people leaving healthcare for various reasons. So we, as an executive team, looked at many things going on. Obviously, there's the negative impact of COVID in general, and also how do we respond to these workforce challenges, knowing that it won't happen overnight. There's nothing that we can do that would make it a difference for the next day. But how would we slowly improve our workforce challenges and ultimately also help our bottom line as well? So we began a journey in the fall of 2021, and I'll share some of those things that we did as a hospital in a system that I think may be relevant to what we're talking about today as to how did we respond, and then included in that is about the contingent staffing agency. So one of the things that we did was we've had a productivity and a benchmarking tool for many years, but we really embraced it at this time because we really needed to know how much staff do we really need. Do we have are all the open positions really warranted? And before we focus in on what do we need to do about them, how many do we need? So we have a process improvement engineer that really helped us focus in on workflows. I think another key thing that came out of that was the development of a workforce council. It's about 9 or 10 members. It does not include the executives. These are leaders in our organization. They're the ones who look at these productivity and benchmarking tools, work with the peers at the hospital, peer-to-peer, what's going on, how can I help you? And they do education videos about productivity and benchmarking, position control. How do you prepare your budget? So we kicked that off, and it has been highly successful, and it really helps the leaders take that ownership without us as executives, them looking at us as forcing it down. They've really learned about it and have embraced it. And it also lets them to contact peers in other companies, other facilities, because the benchmarking is with 750 other facilities. So it really has opened up their world as to looking at how things can be done differently. I think we all looked at technology. How do we use technology to fill workforce gaps? That's really new, and it's hard to embrace it at first to say, do we need less people if we have technology? So we're continuing to be educated and looking at, do we bring in different robotic functions to deliver food, to deliver medications, to clean the floors, and then some AI technology for routine functions. I know I've been introduced to that over the last year or so too, through our associations. Obviously, wage and benefits, we really needed to look to see, are we really competitive? And really understanding what the new workforce is looking for. We don't necessarily have historical trends to help us anymore, because this workforce is different for us, and we really need to adapt to what they want. And so when we look at the benefits and wage package, we can't be blinded by the past, but really be sure that we use our industry experts, those HR consultants that can say, this is what we're seeing, and this is a path you may want to take, which I think is still another journey for all of us to kind of transition from one to another. One of the ones that I've been learning more about is pay for progression. In the past, you get your annual merit increases, maybe some market if your job has changed significantly. But what we're finding with the workforce is they want to know what you're going to do to keep them. How are you going to make me happy? I've been here 6 months. Are you going to give me anything after being here 6 months? So keeping an open mind about that. And I think if we don't consider how do we partner with our payers and looking at those contracts, our costs have gone up everywhere, whether it's wages or supplies, contingent staffing, whatever it is. And our reimbursement in healthcare does not go up. I mean, we're still going to be only able to charge $100, even though our cost just went up 15%. So I think it's important also in your plan to work toward your workforce challenges is how do we start shifting dollars around, and how do we partner with those payer contracts? And we've opened up contracts, and we've been pretty successful in the last year of some contracts, but don't lose sight that when you do payer negotiations, they are looking at your cost reports. They're looking at how you need to provide them the data to show that your costs are going up. And I haven't seen a payer yet that isn't willing to take a look at that. So I would encourage people to also ask to open up contracts. And when we opened them, we only asked for a 2-year contract because we know that we're still in the midst of the COVID pandemic and all of the effects it's still going to have. Our wages still going to go up, or our costs really going to go down. And so they've been a good partner with us on that. And then as we look at as we look at all of those things to help with the workforce challenges, how do we shift costs around in other areas? Obviously is to bring down costs in other areas. How do we bring down money here, costs here, so that we can put it for the staffing requirements for our future? And some of those costs, obviously, is the contingent staffing. We're going to talk a lot about that today. How do you reduce those costs and also reduce vacancies, because you can't have one without the other? So you really need to develop a recruitment and retention strategy. What we did was said, not every position is equal. Not every position can be recruited for the same. So we broke our positions down into 5 categories. We had about at the total, at our height, we had over 400 positions open out of 2,500 employees. So we broke it down and put them into groups so they became more manageable. We would look at, the LPNs, the RNs. We had a group called technical professional. They're really looking at things differently. And then you have the entry level. They're very different than the other groups. And then you have the management level. So by breaking them down, we were then able to develop some recruitment and some retention strategies that really focused around what are these groups looking for, because it isn't an all-for-one approach. And through that process, we're also able to develop some priority lists for our recruiters so that with that many positions open and the challenges of even hiring them, it helped give them some focus as well. And we reached out to our partner, our contingency staffing agency, to say, what can you do to help us bring our costs down? What can you do to help us in this journey? And we'll talk a little bit more about that as well. We looked at other expenses such as supply chain. How do we bring those costs down? So we developed a work team that focuses specifically on supply chain. They meet every 2 weeks, because if you only meet once a month, you really aren't going to get where you need to be by the end of the year. We were very fortunate, and many of the members of our association in our area, we have United Iroquois Shared Services, or UISS, which is a regional GPO. They were very proactive and reaching out to members to say, hey, how can we help you? We know that costs are going up, and we have some resources that might be able to help you. So we really engaged with them. Again, we're looking at experts to help us. And they were able to target some opportunities for us to help that team stay focused, looking at purchase services and supplies. But again, it really has to come from the leadership. So we can provide education, which I think it's important to say. We pulled this group together. We pulled leaders into it. We developed some quick wins, and they were able to engage with it, embrace it, similar to the Workforce Council. And so we've been able to really improve our ability to reduce some of those costs. We reduced our costs $1.5 million last year, and we've set goals this year as well to reduce costs. And again, it's across the organizations, and the leaders embrace it because they understand the bigger picture. They understand we're trying to meet the needs of the new workforce. We want to fill all the positions that they have open, but in doing so, we've got to find ways to move some costs around and ultimately reduce some, but how do we move some around? And we also embrace value analysis. That is really about standardizing purchasing, involving the clinical stakeholders to provide high quality care, but at the same time, the standardization allows us to have reduced costs as well. And then from a benefits perspective, how do we need to find out what do the workforce want for benefits? We always thought they wanted health care. We always thought that it was just about money, but it really isn't about money necessarily anymore. They're looking for, as we've engaged with consultants on this, they're looking for that life and work balance. They want flexibility. Childcare is a huge, huge concern for them. There is shortage of it, and the costs are very high. I was so surprised when my son told me that they're paying $250 a week for childcare for one child, whether they're there or not. I'm like, wow, that is like a mortgage payment. So I can understand how childcare is so, at the level, that the workforce is really looking for. So how do you become an employer that they want to come to, because you're willing to look at how do you shift benefits around so that you can provide them with some of the ones that they want. I think just a few other strategies that I wanted to share with everyone is I think it's very important to be transparent with your leaders. What we did was we wanted to be sure the leaders understood that this was not an HR problem. It wasn't about HR not being able to fill these positions, that we didn't have enough recruiters, or we weren't proactive. And it wasn't a Samaritan problem. This is a national and regional problem, and keeping them educated about that and having them be part of the solution, again, is key to turning this thing around. They need to learn, helping them. So we've got classes now that help them with interview skills, behavior interviews. How do you look at a resume? How do you, and helping them, in the past, if you got an application, I might not look at it for 3 days because I know that person was going to be there when I was around to it. And now it's about, you get an application today, you need to get on the call with them today, let them know you're interested, and really roll out the red carpet. If you wait a day or two, you're going to lose that opportunity. So again, engaging with leaders to help them see how we have to change. We cannot be the same employer. They cannot be the same leader as what they have done in the past. So we've had education on that. Obviously, retention is a huge focus. You have to be able to provide a better work environment because we can bring in as many as we want if we can't keep them. So I think there's a focus. We hired a retention specialist to help us round on new staff, engage with them, round with leaders, because leaders need the support. I think leadership development is a huge part of retention. So we have a focused education department who is doing a lot of crucial conversation skills, interview skills, communication, so that when we do get that new staff member in, they're more likely to stay. And I think that one of the last things that was powerful for us to see was that we couldn't hire enough experienced professionals to come to our area. It's a beautiful area. We're right near the St. Lawrence River. We're Lake Ontario, very gorgeous area, but we have very harsh winters, and it's not for everyone. So it's a very difficult area to recruit from. So as we discussed how do we conquer this workforce challenge, it was very evident to us that we really need to do more to grow our own. And meaning, how do we engage our community and the families and the children going to school? How do we engage them to see healthcare as a potential profession for them? not just nurses and doctors, but we need accountants and billers and housekeepers, and how do we help them see the bigger picture about healthcare? So we've developed a very active community approach. We're developing healthcare clubs in the schools. We're developing student sponsorships. So if Susie decides she would like to become a scrub tech in the OR, how do we sponsor her through her education so she comes back to our community and provides those services to our community? So we've done a lot of work, like increasing our clinical school affiliations, so more students are coming through our office. We've obviously support our employees. We're helping them define ladders. We're spending a lot of time going through to say, so instead of having, you're going to come here and you'll work 15 years and you'll stay in the same position, we're saying, you know what, you have the ability after a year or two, this is the next level, and then this is the next level, to help them with that desire for pay for progression. If we keep moving them up, developing their skills, they're more likely to stay. And I think from the last thing I'll say is, from a nursing perspective, I think that's our biggest challenge in our workforce. And we're all vying for those nurses. And the schools in New York State, have increased their capacity. I know they struggle because of the ability to have faculty. But I believe the number one approach for nursing is professional growth. They want support. They want to know that someone's going to help them continue to grow in their profession. And so I think a residency program is the most important thing that a hospital can do, is develop that program so that they have, a way to come into your hospital and be part of an ongoing program. It's usually a year long, and it helps develop relationships with the other nurses as well. So as you can see, we took this in a multifaceted approach to overcome those workforce challenges. I think what we've put into it, we're starting to see some really good momentum. And I believe that 24, by the end of this year, we'll see some really good movement based on all the things that we've been able to implement.
Well, Maxine, thanks so much. That's fantastic. And I want to hear more about that recruitment council. I think that's something that a lot of people could really get behind. Megan, I know that, you're a very seasoned HR practitioner, and I love your story about, having your child at the hospital. So that's fantastic. I hadn't heard that one before. But when you're thinking about workforce challenges, could you elaborate a little bit more on your experience as that seasoned HR practitioner, about kind of what it was like before you had an MSP, and talk about how much time and energy was spent kind of on that temp staffing locum side prior to the use of a VMS/an MSP?
Yeah, absolutely. I'd be happy to. One thing that I didn't say that might add a little extra flavor or commentary is also during the times of COVID here, which seems like a very far but not too distant memory. I was also the interim director of the Med Staff office. So talking about staffing and moving providers through a timeline quickly to have them hit the ground and start working to provide services to the community, doesn't lose itself on me. So I recognize all these different issues that are out there and about with our different pockets of the business. So I'm just going to take you on a little story, if you will. So I shared with you guys that our medical group came together in 2018. And what that meant was we had all of these different hospitals with different practices, different relationships, different contracts with multiple different flavors of staffing, locums, you name it, agencies out there. Every contract had a different signer, had a different scope of work, costs across the board. There were no controls in place. So when I came into this role, standing up physician services, there was no way to easily look inside and see what our actual spend was, what our actual placements were, and what we had for coverage or available resources out there. It was the wild, wild west, if you will. So I recognized, as being an HR practitioner, my whole role and my whole goal is to deliver an excellent experience. And in my mind, I was thinking, what kind of experience is this for our leaders, our administrative and clinical leaders, if we can't give them any type of insight to what we have for availability out there to them, we've got to do this and we've got to do it better. So I started my journey thinking about what we might be able to do. Had the privilege of going to multiple conferences and seeing different solutions out there in the workplace. And one thing that struck me was this MSP platform, because what that does is it eliminates all the noise out of the system. There was so much noise with so many people with their hands in all these different cookie jars. There was no way to stay organized. So by engaging in this type of relationship, what it did was it allowed me to build a locums program. And this MSP that we have in place now is so fantastic. It's like an extension of my physician services team. I can go, I can tell them, hey, I've got this need at our location in Middlebury. I need you to fill it. We need an APP, ASAP. Can you help us do that? And the beauty is I have an assigned account manager who, again, I'm going to say, like an extension of my team, I can call up and say, hey, Amy, I need help and I need it now. She'll jump on it. She will work with all my partners internally and then work with my internal onboarding coordinator that I have here that just focuses on locums administration. Locums administration, if you look at that as compared to a local perm hire, it's about a 30% more FTE lift because of the urgency of the matter at hand. So it compresses our timelines and makes it really difficult to move thoughtfully through the process. So by having an extension of my team, a dedicated account manager, me putting in place a locums onboarding coordinator has been a fantastic addition to the service and experience that we're delivering to our clinical and administrative leaders. The other thing I would say is it was so hard to see how much our different partners were paying. We just started becoming competitive against one another. It was so difficult. Now, given the technology and the platform I have availability to, I can look and see at any time, what do I have in my staffing pool? What do I have for my spend? What are my trends? Who do we have on med staff before we might want to consider calling back? Just today, I had somebody call me and ask me, hey, how many physicians do you have on locums assignments at your Central Vermont Medical Center? Within 5 minutes, I could log right onto that platform, dig right in by specialty, and I could tell you how many people I had on assignment previously, current, and future. It is amazing. There is no other way for the value we could get that type of service. It is an enhancement. It's made my life a whole lot better. If I wanted to continue the pathway we were without this type of collaborative system, I think I'd probably have to have about 3 FTEs managing this whole workflow. To give you a sense of what we've done since we've engaged in this type of relationship, we have put out there 138 different recs for needs that we've had since 2022. We have gotten candidates 499. There's no way we would have the time, space, or energy to be able to get access to that many candidates. Of that, we only placed 89, which tells you the value that you're getting from being able to weed out the different individuals who might not necessarily pass the sniff test. And the other tremendous value is I shared, we had so many different vendor contracts out there. How do you keep track of all of them? Now they're all under one cover. We actually have access to 42 different suppliers, which shortens our time to fill, place, and we've got people in practice servicing our community much sooner and much readily than we did before. It has been a game changer in my space. So, yeah.
That's fantastic. Thanks so much. For this next part of the presentation, we're going to pass it over to Jeff Niles. Jeff, take it away.
Thanks, Tommy. So as we look at where we are in the contingent workforce industry, I think it's important to also take a look back in history to figure out where we need to go. When I started in this business in the late 90s, early 2000s, the common practice was healthcare systems would work with multiple staffing agencies, very much in the model of what Megan describes. Locums is relatively new to this model, so that explains why her organization came around to this a little later. But in the nursing and allied world, in the early 2000s and 1990s, one hospital could work with dozens of agencies, manual processes, phone calls, faxes, even before emails were part of our everyday life, different rates, lots of burden of work. Then evolved into the vendor management technology entered the marketplace. And ShiftWise was one of the companies that I worked for during that time. And these types of systems were, while they were new to healthcare, were not new to contingent workforce management. In fact, they had been in place outside of healthcare and IT during the whole Y2K and that whole time frame to help other organizations manage their IT vendors. So the idea came from traditional industry into healthcare, and those platforms exploded in popularity across the country for managing both local per diem agencies as well as travel nursing or travel allied health professionals. That became the predominant model for health systems that were looking to get away from the previous model. At the same time, staffing agencies emerged with what we call a master vendor model, which is a staffing agency contracting with a facility to be an exclusive staffing provider supported by, in many cases, a VMS technology, but not always, and an affiliate vendor panel or a sub-vendor panel, which would support the agency in filling positions they either couldn't fill or didn't want to fill. And those two models really battled it out, so to speak, for an entire decade. And eventually, in my opinion, although I'm very biased, it became clear that the vendor-neutral model had a lot of benefits to the healthcare system that a master agency could not provide. And following the trends outside of healthcare, that became apparent as where the industry is going. Not surprisingly, staffing agencies, many of them recognized this and decided to get on board and partnered with the VMS companies and enjoyed record growth in sales. Were given the opportunity to fill positions with clients they never even dreamed of working with, and now had access to orders nationwide, and were able to scale up their organizations very quickly. This also, however, placed competition against the larger staffing agencies. So there was competition from smaller bootstrap agencies benefiting from a vendor-neutral model, as well as staffing agencies losing market share from their own MSP programs that were lost to the VMS technology vendor-neutral model. And so in the era of the 2000s to the 2020s, we saw what we call the era of acquisition, which is many of the previously vendor-neutral models, whether they were hospital association-based or GPO-based or independent technology companies, began to be acquired in large numbers and at an aggressive pace by large staffing agencies, essentially boxing out that model from the market. However, during COVID, the drawbacks to that model became very apparent. For health systems that were bound to tight exclusivity provisions with one agency, found themselves during COVID severely understaffed and being not able to compete with other health systems did not have similar restrictions. And so the trend now is moving towards a vendor-neutral model, by and large, due to the desire to have greater competition, access to supply, transparency, and probably most importantly, advocacy. So we talk a lot in our organization, and I hear other organizations that fit our model talking a lot about providing advocacy to their customers and helping them to understand how to navigate the contingent workforce industry as the buyer, as the owner of the demand in an increasingly competitive market. So Tommy, if you want to go to the next slide, some of the challenges I've already alluded to in the master agency model, which is, lack of access to the larger market. While agencies may, in theory, be large, even the largest staffing agency in the country only has about 13% market share of the total spend in our marketplace. So when you then look at those agencies then subcontracting down to a group of vendors which doesn't represent the larger market, you really have lack of access to total supply. And so we talk to agencies all the time that work with large staffing vendors in the master agency market and model, I should say, and they continue to be frustrated that they're not getting access to those needs, even though they may have the most highly qualified candidate available to that customer. We talked about competition. Obviously, economics 101, if you have one vendor for anything, you've lost the ability to have competition. You can negotiate, but in the end of the day, if you sign an exclusivity provision, you are bound to that agency, and therefore you are in a very, very poor position to negotiate rates and terms. Terms themselves, obviously in a business environment where there are conflicting motivations and goals, there are going to be contract terms in an agency-driven model that favor an agency versus in a vendor-neutral model, we very much have the ability to create contract terms that favor the healthcare system, which goes along in conjunction with the advocacy approach. Limited access to candidates, we kind of already covered that. And then guarded access, this really is about transparency. Very few health systems that we talk to or that I speak to have a good idea of even what goes into a bill rate and how that is determined and what impact pay versus bill can have on the access to supply. So in a vendor-neutral model, you very much have greater access to information. And for all of those that may be out there that, you know, will argue that a master vendor MSP is truly vendor neutral, there's a lot of evidence out there that that's a sales pitch. You can ask any agency out there to name off the vendors that are vendor neutral and those that are not, and they'll tell you. And it's gotten to the point now where there are articles on this and even lawsuits between healthcare providers, health systems, and their formerly vendor-neutral MSP providers. So this is a real issue. We bring this up because we think it's important for healthcare systems to understand you do have choices, and that in many cases, you are at a greater benefit to have a vendor-neutral model that's going to be your advocate. And we've already talked a little bit about these benefits. I want to leave some time for questions. So we can leave this slide up here, Tommy, but maybe get into some questions for Maxine and Megan, since we really want their stories to shine through.
Thank you, Jeff, Tommy, Megan, and Maxine for a great presentation today. We will now begin today's question and answer session. Again, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. Let's get started with this first question. How do you know if an MSP provider is actually vendor neutral?
Well, I can take that, and then I can pass it off to Megan, perhaps, because I think she probably got a lot of fierce whispers around when she made the decision to go in this direction on that topic in particular. But there's a couple different ways I would answer it. First of all is, like I said, ask the staffing vendors that you work with or have worked with or know or have met. They know the industry, they know the players, they'll let you know. The other is the technology itself. So most VMS platforms, it's very easy to see which job orders have been distributed and to which agencies those have been distributed. And furthermore, when that happened, time, date stamping and technology is common. So it would be very easy for anyone using a tool like that to log in and see which agencies receive those orders and when. And that'll tell you all you need to know on whether you have a vendor neutral model or not. Some of that may be hard to assess during a sales process, but certainly you can ask for references and speak to other clients that are working with that provider and ask those questions on what they see. And you can also see it on the reporting on the breakout of spend by supplier. if 80% of the spend is with one agency, then you kind of know what you're dealing with.
Yeah, Jeff, if I could jump onto the back end of that a little bit, I think the technology is the biggest piece, right? It gives you visibility into the spend, and you can see it across the board from right to left. So it's really easy to identify some of those different pieces. I would say another advantage beyond just the technology is a partnership that you have with account managers in this situation. They are looking out for your best interest. And just a quick little example, I get called by locums agencies all the time saying, hey, Meg, we want to get some providers up to you. How do we go about doing that? Let's get an agreement in place. The beauty is now I can push over to my friendly account manager who's going to take that and own the whole contracting piece of that. But also, one recent time I had just that situation happen, passed it off to my account manager. And what happened is shortly thereafter, I got a phone call. And the phone call was, hey, Meg, I don't know if you want to go with this locums agency because they're not super great about paying their invoices on time or processing their invoices on time, which then puts the provider at risk from providing services at your locations. So I think just having that additional partnership and set of eyes, whether it be on different vendor supplier relationships, quality of the provider coming in, and then the cost spend is just a tremendous value add, in my opinion, something that I don't think I would have time to do if I kept that with all the multiple locums agencies out there that we had previously.
I could just, I was just going to add something very simple, and I won't talk very long about this. I used to be under a master agency model, and now seeing the vendor-neutral model, it's very, very clear, because if you ask, what is my cost I'm paying you to do this, you cannot get to that number. They're very smoke and mirrors. I never knew exactly how much we were spending. And I think that's the big red flag that I would share about the master agency model. No transparency.
We have our second question. Apart from the benefits listed on the screen, can you think of any other benefits that you have seen using a vendor-neutral VMS?
Megan, would you like to start?
Yeah, I'm just looking at it a little bit more. I really think, the time to fill, that's what's so important to me. I need to get providers in quicker, and by having a larger pool to choose from who are bringing in the door, it's getting people to provide services, which in turn is generating revenue, which is huge. I think for me, that's tremendous. And what it's also doing, well, we all know locums in place for long-term is not a long-term recruitment strategy. By sometimes leveraging locums, we are giving our other full-time physician staff some very needed and deserved breaks in their service as well. So I think it just gives me real time and access to providers sooner than I would have had to if I was doing it on my own.
I would agree with you, Megan. What I found refreshing with the vendor-neutral model was just I already spoke about the transparency piece of it, but that engagement, they truly care about you, or at least make you feel that way. They have been on site routinely to meet with managers to ask what it is they're looking for, how are they providing their service, is there anything else they can do for them. They've actually came and they wanted to know our area so that they could better recruit for the staff, the replacement staff that were coming. I was really impressed with how much time they took to get to know us. And because of that, I think they're able to really maximize what they can do for us.
Yeah. And I think one other thing that I would share, and this is getting into the weeds and a little bit of administrivia, but man, the invoicing under one cover is so much better than getting a million different locums invoices all throughout the month, different times, different amounts, trying to reconcile them. Having one to however many invoices under that one cover is truly a time saver and just a beautiful thing to be able to look at what your real true costs are for that provider.
Another question here is, why do you believe vendor neutrality is important in a VMS/MSP partner?
I would say it's because they're working for you, and in my opinion, they're more about working for you versus working for themselves.
Yeah, I would agree with that. Just being able to see what those rates are across the board versus trying to perform that, behind the odds guessing game is just tremendous. They don't have the skin in the game, so to speak. So they'll roll their sleeves up and make sure that they're helping you get the best rate for the best value provider out there.
Another question we have is, what are the ways to measure the success of an MSP program?
I think that one's got Jeff written all over it.
Yeah, well, so this is a good question. I was going to see if you jumped in, but so one of the ways that we do it, I won't speak for other VMS providers out there, MSP or vendor neutral model, is we provide not only real-time access to information through a number of dashboards, which provide not only the utilization and spend, but time to fill rates, completion rate, extension rate, things of that nature. There's probably 9 or 10 different what we call KPIs or key performance indicators that we track in every single program. And we review those, and our teams are actually, their performance is judged based upon those numbers. So there's a lot of soft benefits to our model where we're, helping with communication and things of that nature. But in the end of the day, we're looking at filling positions at a high rate in a quick way at the lowest possible cost at the highest possible quality. And there's a number of metrics in there that you can look at that will determine whether you're doing that or not. So that has a lot to do with just providing information back and then using that information to improve. So some of the improvements could be on our team or the vendor neutral team, but also sometimes the improvements are on the client side. And it might be things like Maxine brought up. You can't sit on resumes or candidates for long in this market. So if you see a good candidate, get the interview done or benefit from an interview service offering, which we provide, and get that done quickly. That can move the needle on time to fill as one example. So it's a myriad of data points that we all collect. And I'm sure if there are other vendor neutral VMS companies out there, they're doing something similar to provide that information back to you.
And I think, Jeff, just to piggyback off that, for Maxine and Megan, really it's hard to quantify, right? But taking that stress off somebody, the job satisfaction that a recruitment professional or someone in HR has by not having to field those phone calls or deal with, as Megan referred to, as the wild, wild west, having things in a more packaged way so that things are done in a process and have a plan. I think you'll see a lot of dividends and a lot of on just satisfaction of those people within that recruitment enterprise as well.
Oh, absolutely. I think the folks who were doing all those different tasks, and it was all over the board, it was clinical leaders were doing it, administrative leaders were doing the recruitment for these different pieces. And now we have that program, and that program does all of this work in a very centralized, organized fashion. And all of the customers are much more satisfied with the end results, for sure.
One last question here before we run out of time. What has been the biggest lesson learned in the process of partnering with an MSP?
I mean, I think for me, it's you don't have to do it all yourself. There are trusted partners out there who can help you get your arms around and gain controls over the locums staffing world. And it just, the administrative lift that is removed from my team has been tremendous. And we have built trust and accountability with these different pathways we've built. It's just really enhanced the experience for, again, our leaders our incoming providers and the teams that these providers are being placed into. It's just been a really nice extension of my team, and I'm grateful for it.
And I don't know if Mackenzie, you were going to mention this, but we do have a lot of questions that came in that we were unfortunately not able to answer. So there's contact information up here, but we will also provide answers to all the questions that were submitted, and we'll provide those answers to everyone. So just wanted to let you know, I see a lot of the questions. I think we got over 30 questions, and I'm sorry, we ran out of time, but we will get those answers to you.
This is all the time we have for today. I want to thank our presenters for an excellent presentation and the HWL for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today. We hope you all have a wonderful afternoon.
Thank you.
Thank you.